Welcome to the Friends of NPACE Podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com.
Welcome, everyone, to the Friends of NPACE podcast. And I'm so excited to do this series. This is our Dear Future APP series. I really started this, I was telling Kathy, is like a love letter to all the future APPs because we love students. We love bringing people into the profession. But I'm Terry Schmidt. I'm the Executive Director of NPACE. If you don't know, I'm a practicing family nurse practitioner, and I'm so excited to have our guest here today. I've kind of alluded to who she is, but I especially love her not only because she's an amazing speaker, and I always learn something from her, but also she knows I love bats. So I brought Carrie because she gave me bat earrings, but I don't have them in. We love bats. They're great. They're adorable. They eat mosquitoes. So she knows I love bats, and she gives me bat gifts. This is Dr. Kathy Baldridge. Dr. Kathy Baldridge, you're a family nurse practitioner in Alexandria, Louisiana, correct?
Correct.
Okay, and you are the NP education specialist, the lead for advanced practice education at APEA, correct? Did I get that right?
Yep.
And that's an ATI brand. You are also the author of Coding and Billing in the Outpatient Clinical Setting, that quick guide, and you're now editor of Dr. Ollier's Clinical Practice Guidelines, a great book. I still have mine here on the desk. Yep, I use it. You are a sought after speaker. You presented extensively across the country at national levels. I love when you speak at NPACE, but you are so deeply committed to NP practice and NP success and the success of students in the profession. You have been on the Louisiana Association of Nurse Practitioners. You've been the board. You've helped lead them. You are past president, right? Immediate past president? Okay. And you've been working with statewide initiatives in Louisiana for NP practice. And let's see, I have that you earned your associate, your BSN, MSN, and DNP from institutions across Louisiana and Alabama, and you're in Alabama. Okay. Did I get that right?
You did. Perfect.
And you're an AANP Award of Excellent recipient and an AANP Fellow.
I am. Thank you so much for having me. And you are right. I am passionate about our profession. So past, future, present, everything. I want to make sure that we are forward facing and ready for healthcare challenges because they're out there, but I know that we're up to it.
I appreciate that. I appreciate your dedication, particularly to students. When I was really building this series, there is no one that I know that's more of an expert on what NP students need for certification exams. So thank you for sharing your time.
Thank you for having me. I'm excited to talk about it.
I am too, because we're going to talk about myth versus fact, but I wanted to start off and let you kind of set the table so all nursing and PA students and NP students out there. So for NP specifically, what are the current national certification landscape look like? What are the certifying bodies? What is the national certification exam? Why should they care?
So we have to be certified in order to be reimbursed for our services. And that's one of the things that really separates us from pre-licensure undergrad RNs is that we can bill for our services. In order to do that, we have to be nationally certified. So there are some states out there for NPs particularly that don't require certification for licensure. However, federally, CMS says that you have to be certified in order to reimburse for your services. So we got to make sure that we are able to pass that certification exam. there are multiple different certifying bodies depending on what your role is that you're being educated in. So for FNP and adult gero, there's AANP and ANCC. There's a few different certifying bodies where, if you're doing pediatrics, for example, or women's health, also for acute care. So there's some different certifying bodies for those. But across the board, you have to be nationally certified to be reimbursed for your services.
Okay.
So that's important.
And the list of states that don't require national certification is like dwindling. Are we down
Very
to 2?
much. Down to 2. Mm-hmm.
Okay.
And that's going to be changing. I think several of them, or one of them, has already passed legislation that says you're going to have to be certified in the future. But it's like a graduated rollout of that law.
Okay. Would they be
So it's
grandfathering in then practicing NPs?
I'm sorry, say that again.
Will they be grandfathering in practicing NPs?
No.
Oh.
You have to be, because again, I think that's where people kind of get confused, is they get confused between certification for licensure and certification for reimbursement. Gotcha. And so certification for reimbursement, you may be grandfathered in for licensure reasons. I mean, they're not going to take your license away from you if you're not certified. So you may be grandfathered in for that reason, but for reimbursement, CMS requires certification. So, I have people in those states that reach out to me because they know it's coming. And they're like, I really didn't have to be certified when I first started, but now I feel like I need to be certified and I want to reimburse for my services. So what do I need to do? And we help them navigate that so that they can pass that certification exam.
Okay. Good to know. See, I always learn something with you. Here I am learning. Before we jump into strategies and even myths, one of the hot topics is among NP students, and they get on Facebook in groups and they talk to each other, they text each other. It's exam pass rates. Mm-hmm. So let's talk about just AGNP and FNP exam rates. So that would be AANP and ANCC.
Correct.
I've heard there's concern about declining pass rates over the past decade. Like, what's the truth? Where are they at? What does that look like?
So actually last year there was an improvement, so that's good. And we did expect that there was going to be a rebound in that. Okay. There was a drop certainly during COVID. I mean, the whole world changed during COVID, right? Yeah. And there was a decline in that. And schools have changed, and not just for nurse practitioners. We see it happening for med students too, but we see more and more online programs. There's more and more focused on the adult learning principles and competency-based education. And so anytime that there is a shift in how education is delivered, you can expect to see some decline, and it takes sometimes a 2 to 3 year paradigm shift, time for that paradigm shift to occur, and you'll see some bounce back of that as people kind of settle into the new structure for education.
Okay. All right.
One of my opinions.
No, I think that's true. And of course, COVID, man, it just kind of
COVID changed the world.
Yeah, it sure did. And some in good ways, right? So we've learned a lot more, and where we should be. All right. Yeah, I appreciate that.
And I'd like to, if you don't mind if I expand on that just a minute, for the students specifically, because I know that sometimes they don't really pay attention to those pass rates until it gets close to time for them to graduate. But I would like to challenge you that as you're looking for a program, that you pay attention to the pass rates initially when you're deciding which program you want to attend. That would be an important thing for you to put on your list of criteria in choosing your program, is what are their pass rates for them. Yeah.
Yes, because they get those and they should make those publicly available, their pass rates. So the national average is about 83% right now for those exams. Okay, for the family.
For the family. Yeah.
Adult Gero is just a little bit higher. It's like 87.
Just a little bit higher. But when you think of statistics, when you delve into the world of statistics, and most people I talk to, I have a daughter-in-law that's in school right now, and she's having to take statistics, and she's like, oh my gosh. But, you don't have as many students that are taking the adult Gero as you do that are taking the FNP, and that impacts those end result percentages sometimes. And when you look at the difference between AANP and ANCC, we didn't see as significant a drop in ANCC pass rates over the last several years as we did in AANP, but there's also a whole lot more students that take AANP than ANCC as well, probably about 75% to 25%.
Interesting. It
And
wasn't that
impacts
way
those
years
statistics.
ago.
No.
Yeah.
Well, ANCC it was the OG of certification exams. They were the first one that was out there, and so a lot of us that have been practicing for a while, that was our initial certification because it was the one that had been around the longest. So
you just call me out on being old there, Kathy, but yeah.
Same.
Exactly why I took that one. So thank you for setting the table there and just kind of expanding on that. I think that's a great way to then pick a program that you mentioned, looking at their pass rates when you go in. All right, I want to get to the myth versus fact because students hear a lot of things that are not true.
Oh, yeah.
Right?
They do.
And sometimes they don't hear some things that are in fact true that they probably should know before they start school. So I have a list of myths and I want you to tell me if they're true or not.
Okay.
So we're going to start with myth 1. If you don't pass your certification exam on the first try, your career's in trouble. It's over. You're not going to get hired.
Absolutely not. And if I can put one fear to rest, and this is kind of how I have lived my life and how I encourage others. First of all, how wrong of us is it to look at failure as failure? Failure is an opportunity. It's an opportunity for growth, an opportunity to expand yourself. And that's how we should view it. So absolutely not. I never look at a person who didn't pass on the first attempt and say, oh, you're in trouble. Don't even bother going into this profession. Absolutely not. There are a lot of things that can impact your ability to pass on that first attempt. Anxiety is one of them. You could get in traffic on the way there, and that really kind of got you off center. And unfortunately, the best measure that we have to measure knowledge and critical thinking is a didactic exam. But that doesn't mean that you're not good at what you do. And there's ways that we can help overcome that. So no, if you don't pass on the first attempt, you are not in trouble. Step back, create yourself a game plan, and you'll be successful the next attempt.
Okay. I like that. Don't give up. Make a game plan.
That's right.
You're not in trouble if you don't pass the first time. Okay.
Correct.
Myth 2. One exam is easier than the other.
Define easy. I wish we had an easy button that we could just hit and say, yes, it was easy. And I think when you hear that, you have to consider the source. And I've talked to lots of students all over the United States, and some will say, oh, yeah, this exam was easy. And some say, oh, no, this exam was hard. So first of all, you're not getting the same questions on every exam. They get different questions. And not everyone starts from the same level of knowledge or preceptor experiences or those sorts of things. So be cautious when somebody says that something is easy or hard, that they are just telling you from their perspective. But if you had to choose between one or the other exams, not one is not necessarily harder than the other. And actually, in the last probably 3 to 4 years, they are more alike than they are different.
Okay.
Yeah, we used to hear that ANCC was more focused on theory and professional role and leadership, and AANP was more clinical. But they are, if you look at their exam blueprints, which you can find online, and I do encourage you, if you're trying to decide which exam you want to take, one, look at the exam blueprints to see that they're much more similar than they are different. And two, I know you're not thinking about recertification, but look at the recertification requirements. That'll help you determine which exam to take, but they are more alike. Another myth I hear in that area about exams is that you have to be ANCC certified if you want to teach, or if you're going to work in the hospital setting. Again, CMS doesn't say that you have to be ANCC certified to be reimbursed. They say that you have to be certified. So pick one. Doesn't matter.
I like that. Okay. So they're really more alike than not. Go
Really
and
more
look at the blueprint and the certification requirements for what you're going to need to do in 2 years or 5 years or to stay certified. And you don't need one or the other for hospital.
Correct.
Or okay.
You just have to be certified to be reimbursed.
Just certified. Got it. Okay. Next myth. If you're a really good clinician or a student, you don't need a formal review course. What are your thoughts on that?
So let me tell you, I'll tell you my experience. And again, it has been confirmed for me anecdotally through the years of teaching NP students. I was one of those students that I was like, why are they making me go take this review course? If I haven't learned it now, I'll never learn it. And I just want to go take my exam. And after I walked out of that review course, I was like, oh my gosh, I am so glad
that you took it.
Yes, because can I tell you, light bulbs went off. And it all came together and was tied up very nicely in a bow. So it really did summarize what I had learned in my program, brought some things that I hadn't looked at in a while back to the forefront. And I feel like that very much prepared me and helped me to be successful on the certification exam first attempt, which was very important for me. And it is for everyone. But yeah, I think, and I've heard that from students, they're like, oh, I didn't really think this was going to help me. But I can see the light bulbs going off when we're sitting in a live audience and they say, I feel like, this is the line, I feel like I learned more in these 2 days than I did in the whole program. They really don't. Right. They really have been learning precept upon precept, line upon line. We just bring it all together for them. And so it really is a good thing for you to do prior to going to sit for the certification exam.
I like that. It ties a bow on it. So that's why the bells, the light bulbs and the bells go off. They're like, oh yeah, I learned that thing. Absolutely. I mean, I did a review back in the day. We did them all in person because, that's how old I am.
Me too.
We were talking about being creative earlier. I'm not super creative, and I actually looked for a certification review that had like songs and poems and coloring, and it helped me so much. And there were things in there where I'm like, wow, that really stuck. I mean, I colored the lady who had Lyme's disease and the rash on her hand and her little spirochete hair. And I thought, I'm never going to forget this.
I know. I always walk around the room like when we're in person, and I love teaching, whether it's online or in person, but in person, you just learn so much. And I always am looking for the people that have like the 6 different highlighter colors and the 6 different pen colors. Yeah, they're my people.
Yep, I get it. Yep. And you highlight your notes and you color code things and write your note cards as you go. Back in the day, kids, we made note cards, flashcards to test ourselves.
Well, exactly. And, I mentioned earlier the adult learning principles, which there's always a transition. We go from high school where our teachers, like, did you do your homework? Did you do this? And they're always asking us questions, and they, you feel like they really care because they're your little chicks. And you go into college, and then those teachers don't ask you, did you do your homework? They're not following up with you. Like, you're just kind of, here's your syllabus, here's what you have to do, and you're kind of on your own. And when you get into a master's level or a doctorate level program, it's even more important that you be organized and seeking knowledge, which is the adult learning style, that you seek out knowledge where you are evaluating yourself, you're figuring out where your strengths are, where your weaknesses are, and where your weaknesses are, how are you going to fill in the gaps in that knowledge. That's all part of that adult learning principle. And the other part of it is, what learning style are you? And we all have multiple. We have one that's dominant, but some people are very visual, and so they need the charts, and some people are auditory and they need the chart's good, but they need somebody to talk them through the chart. Some people have to write notes. They have to write it down to be able to recall that information. And then the other one is kinesthetic, that they have to do something to remember it. So even just saying it out loud, they're doing something. There's some action that's involved in that. And when you attend a review course, especially a live one, you're getting kind of all the components of that adult learning style. As you were listing
all of those, I'm like, I'm every single one of those.
We do. I learned all of those ways too. That's right. Me too.
Yeah. You and I are partial to live in-person reviews because I just learn better in that environment. I'm not distracted, but I know learning has changed so much for so many people. So yeah.
That's why we do all the offerings. So what fits best for that student?
I like that. And I know they have access, like they can go back to it, and they have their book and they have notes, and really all of the pieces they need. Okay. I really like that. So everyone really probably should do a formal review course just to make sure and build on those weaknesses.
Agreed.
All right. Yes. So this rolls right into my final myth. They should study everything equally. Spend the same amount of time on one section as they would another section. Is that true?
Disagreed. And let me tell you what people tend to do, first of all. They tend to focus their study time on the areas where they're comfortable. If they have been a nurse on a cardiac unit for 5 years, they're going to spend a lot of time in the cardiac area because it makes them feel comfortable. They're comfortable in that. They know the information. They're like, oh yeah, I got this right. I got this right. But I often tell students, Murphy follows me around. You know who Murphy is?
Yes.
If it can go wrong, it will.
It will.
Yes, it will. Friend. So when you sit down to take your certification exam, your first 20 questions are going to be on women's health, which you said, I'm not doing that ever, and didn't spend a lot of time studying it. So it's not all equal as to where you spend your time. So the first thing is go back to those blueprints, like I mentioned earlier.
Yes.
Both of them will kind of tell you the percentage of questions that you will see in age groups. And so what percentage of questions are you likely to see in pediatrics if you're taking the FNP exam? What percentage are you likely to see in the older adult? And so you can kind of use that as a guide, like, okay, 30% of my questions are going to be on pediatrics. Only 2% of that falls into the newborn area. So you don't need to spend 50% of your time studying the newborn area. So that's a good place to start to map out how much time you need to spend. Then as you're going through the diagnoses, how much time do you need to spend on assessment or diagnosis or planning your care for that patient or evaluating? And they kind of give you percentages there too. So you can use that as a guide if you're looking at hypertension, how much area you need to spend in each of those areas remediating. Then my best advice after that is to take a predictor exam. Now, there are all sorts of exams out there. AANP has, a sample exam that you can take. ANCC, I think, has some too. Other review course companies also have exams out there. If you're going to take one of those, just know what you're taking and know what the score set is, because some of them don't give you, if you score this, you have this percentage of passing, okay? They're just kind of giving you a practice test, but they don't have a score that they've identified as meaning it's predictive, okay? So we actually have a predictive exam. And so we have run those questions for reliability and validity. And we have said that 70% is the score that you're shooting for. So if you score 70%, then you have a 96% likelihood of passing the certification exam on the first attempt. Those are good statistics. I like those statistics.
Yeah.
But the best thing about that exam is it identifies for you where your weak knowledge areas are. So if women's health isn't
study timeline.
Yes, that tells you exactly where you need to focus the majority of your time to remediate or fill in the gaps in knowledge so that Murphy doesn't show up when you start taking that exam and you're prepared for that.
Okay. So everyone should do a live review.
Mm-hmm.
Everyone should take a predictor exam. Don't study everything equally, but maybe take one at the beginning of your studying.
Yes.
And then again, closer to the end to see if you've made any changes. So maybe more than one predictor exam.
At least two, but I wouldn't go much over that because then it just increases your anxiety.
Yeah,
we don't want to do anything to do that.
Real thing.
Yeah.
Okay. Well, so I appreciate you dispelling those myths. So I want to kind of shift us into exam prep. Then we've been talking about it really, but you're the expert. So how do students even begin to build a timeline from graduation to exam day? What should that look like?
So let's start with a backwards date, kind of a backwards design, thinking about that. One of the things that we have found, and not just APEA, but there's other research out there, that students do best, first-time pass rates are increased if they take that exam within 3 months of graduation. Okay. So that's certainly the first date that I would keep in mind. Now, I know that life happens sometimes and, people will have a wedding planned and they're like, oh, I'm not going to take my certification until after the wedding or whatever. But 3 months is really that time frame that we see students do the best. Past 3 months, it's not impossible to pass the certification exam, but first-time pass rates do drop past that first 3 months. Okay, so that's the first time frame that I would keep in mind. The second time frame really is dependent upon how many areas you do need to fill in the gaps in your knowledge area. So that's another place that the predictor exam is good, because it'll identify those areas. If you score a 70 or better, certainly look at what you missed and go fill in the gaps in the knowledge, but you're ready. I wouldn't spend another 4 to 6 weeks studying. Schedule your exam. You're ready to go.
Okay.
If you score less than 70%, then start mapping out on a calendar, starting with your lowest scored area. If your lowest scored area was men's health, then that's where you need to start, and you're going to spend the most time in that area because that's where you scored the lowest. And then go to your next and plot it out on a map. Now, what I found for just about all, a good percentage of students at this level, is that rarely does anyone stop working and just go to school. So I always tell them, first thing you're going to plot out on your calendar is where your work schedule is. So just go ahead and put work 7 to 7, 7 to 7, whatever your work schedule is. Then you use the other days to plot in where you're going to study, how much time you're going to spend, and don't forget to schedule a free day in there. Your brain has to have fun and take a break. So go fishing or, go to a fair or concert, something, do something fun. Don't forget to schedule those things in there. Most of the time, 6 to 10 weeks is a really good number of weeks to prepare to remediate those weak areas.
6 to 10 weeks. Yep. Start with the lowest, take the predictor exam before, be sure you get a full review in there somewhere.
Yes.
Nope, that's all very helpful. So some people just want to take test questions without, like, what if I just get a question bank to review versus actual lecture, talk to me. Is that a benefit or not? Does it depend on how I learn?
Absolutely. Questions are always a benefit. I've heard through the years, oh, well, somebody said if I did 10,000 Q-Bank questions that I would be good. I'd be prepared. Well, you might be, but you might not be. So I don't know that there's a set number, but here's kind of the pattern that I would lay out for my studying. So back to the men's health. If men's health was the weakest for you, then I would look at the diagnoses where I missed questions. Let's say there was a question about prostate cancer and you missed that question and it was all about assessment. Then I would go to clinical guidelines, like the Clinical Practice Guidelines book, look at prostate cancer. What would you expect to see in that assessment domain, which may include the etiology of the disease process, the risk factors for it? That's a big one in the area of prostate cancer. Would you see any signs or symptoms? And what test would you order to rule in or rule out? So that's all part of that assessment domain. So that's a good place to start. Then after you have worked through all of the diagnoses in men's health that you missed, then you're going to go to a Q bank or a question bank, and you're going to say, give me all the questions in men's health. Work through those questions. For those, I don't even care if you missed the question. What's most important is that you review that rationale and you determine why the correct answer was correct and why the incorrect answers were not correct. Because there's usually just one or two defining characteristics, and that's what you need to be picking out for those. And that's going to build your critical thinking skills. Yeah. That's what does it.
Okay. So the rationale is really important. I love how you tied all of this together, right? That predictor exam, and then going back and reviewing that disease as part of your study plan, but then going back and taking some more questions and reading the rationale. Yeah. I love it. It's kind of that learning. Yep.
That learning circle and chasing the whys. That's what I always say. If you are reading a rationale and you say, but why? That but why indicates a gap in your knowledge. And you need to chase the but why until that gap is filled. And so that really does help expand your knowledge base so much. And then you'll read the next question and you'll say, oh, you know what? Because I chased the but why here, I understand this one.
Right, because so much of pathophysiology is based on the same foundations, whether it's inflammation or genetics or cell injury or, makes sense.
That's right.
I like that. Well, I was going to ask you another question about balancing content with test taking, but we kind of got that. So I would maybe switch this because I know you're going to know this off the top of your head. Test taking skills. Like, what do students need to know? Because as we've moved to competency-based, we don't give as many exams in graduate school as we do.
We don't.
What do students need to think about test taking wise? What skills just in the act of test taking should they think about?
Well, so there's multiple things. And the first thing is anxiety. You have got to put some metrics in place and whatever speaks to you that helps you to calm your anxiety so that you can focus on the questions at hand. The second thing, and that's why I don't worry so much and try to tell people not to worry so much about not passing on the first attempt, because sometimes people they have the knowledge base, they're just not good test takers.
Sure.
So how do you
Makes
become a good test taker? One of the things that I think is important, back to those Q bank questions, when you're working through those questions, you should develop a pattern of working through those questions. So you're reading the question and you pick out what the question is asking you. Most of the time, you're already formulating an answer choice in your mind. Okay.
Yeah.
So once you've read the question, look at your answer choices that you have to choose from. Now, again, Murphy follows me around. So sometimes the answer choice that I have developed is not even there. And I'm like, how did they not list that as a correct answer? So anyway, but now you know what 4 options you have to choose from. With those 4 options in mind, you go back to the stem of the question, read it again, picking out key characteristics. So let's say it's talking about community-acquired pneumonia, and what's the first-line treatment for community-acquired pneumonia? Is this patient an otherwise healthy patient, or do they have a comorbid disease? Because that's going to help differentiate treatment choices for you.
Yes. Okay.
Right. So you're picking out those key characteristics, and then you go back to the answer choices and you read them again. Most of the time, you can narrow it down to 2. So you've got a 50% chance now. With those 2 in mind, go back and read it one more time. Most of the time, you can pick out the correct answer after reading it. And if you practice questions doing that way, answering questions that way, then when you sit in the seat to take your exam, you may be a little anxious and you have to do some deep breathing and maybe a little bit of guided imagery. But as you start working through those questions, because you have practiced that muscle memory of how to answer questions is going to come back to you. And you're going to be able to very methodically work through those questions. So that's one test taking tip for sure. The second that I feel like is probably the most important, never leave anything blank. Because one thing I know for 100% true, that if you don't answer it, you're going to miss it.
Wrong.
It's wrong.
So make a guess, right?
Make a guess. I always just say I answer B for Baldridge. If I don't know, if I absolutely have no, just have a mechanism. And then the third is when you go back and look at those questions that you have flagged, unless you read that question and you know for 100% sure that you missed a key factor and you missed the question, don't change your answers. And that's proven in tons of research. Don't change them. So those are probably the 3 most important.
Statistics are like you'll be wrong like over 50% of the time if you go back and start changing answers.
Yes.
Overthinking.
Don't overthink it. That's another good point. I'm glad you said that, because I see students sometimes when I'm teaching, because we have questions that are built into the review course too.
Sure.
And they'll say, well, I would answer A because if, and they'll list off if they had a fever or if they had this or if they had that. Okay, well, look at that question. Does it say anything about a fever? Does it say anything about shortness of breath? Does it say anything about whatever else they listed? If it's not listed there and you have to add an if to make that the correct answer, it's not the correct answer.
Gotcha. Okay.
So that's where overthinking comes in. Yeah.
I used to tell students to take their blank piece of paper, and I know now we used to do paper exams, so cover up the answers and don't be distracted because there's always a distractor. Just read the question and get an answer in your head first, then look at the answers to see if yours is there. But I'm not sure the screen is that way anymore. I think you get the question and then get the answers.
I'm not sure. That's a good question. I'm going to have to ask that question to the certifying bodies or at least one of the proctoring places to see how they do that.
And sometimes they'll give you a scenario and then ask several questions about it.
Well, sometimes not so much. NCLEX is probably more like that. It's an unfolding case study, but not so much on the certification exams.
Okay.
For
so
NPs
one question with the answers.
Yeah.
Okay.
Yeah.
That's helpful. See, I didn't know that.
It is.
All right, we talked about test anxiety a little bit, which everybody's going to have, and I think one of the myths is that, oh, anxiety is good for you. You know, it means you and to some extent that's true, but I don't want people to be non-functional. So how do you tell students to kind of any tips for managing that anxiety?
Absolutely. And I would be worried if they told me they didn't have any anxiety. Those are the people that I would worry about. But anxiety does become an issue when it paralyzes you, when you can't critically think, when you can't get your brain to function at the highest level that it needs to pass that certification exam. So one of the things that I tell students, I'm going to encourage you, and I will encourage you every step of the way. And if you need help, email me and I will encourage you some more. But one of the best things to do to improve how you think about yourself is to remind yourself of all the success stories. First of all, you passed NCLEX and you've been a successful RN for however many years. Remind yourself of those patients who said, gosh, I am so thankful that you were my nurse today. If it hadn't been for you, I don't think I would have made it. Those are your successes. And so we need to keep those in the front of our sight at all times.
You should
And
do
that's
that
going to,
more.
we should, because, you know, you have to encourage yourself sometimes because not everyone's going to be there. And certainly when you sit down at that chair, you're going to be by yourself and you can't talk to anyone around you. So you have to be able to remind yourself, find a quote or a scripture or whatever it is that speaks to you that becomes your anthem, that is implanted in you, that you recall that. And again, that is encouragement as well. Deep breathing, remember to breathe. Your brain cannot critically think if you don't have oxygen going to it, okay? And so I know that kind of sounds crazy because breathing is inherent, but gosh, we don't realize how much we tense and bite down, and that really does impact your ability to think. So there are some grounding techniques that are out there. And so grounding techniques may be doing this, or clenching and relaxing, along with taking deep breaths. And that really will, and you'll feel it just wash over you. Like, okay, I've got this. Your anthem pops in your brain and you're like, I got this. And you remember that patient and you're like, okay, you know what? I can do this. I've got it. And then you settle right down and the muscle memory starts coming as you're answering questions. And before you know it, you're at the end and you're like, I still maybe not sure until you walk out of the room whether you passed or not. But I guarantee you, you've got a much better chance if you're able to bring yourself grounded than with not.
And
Does that
like
kind of make sense?
Yeah, a variety of things, that positive self-talk, that anthem.
There are.
I
There
like
are.
that. And then just get into that practice mode that you've been doing. That's
Yes.
good. I was
Yes.
going to ask about specific test day strategies, but part of that is it. What else? Like,
There's some other things. So I always tell students, pick your exam center well. I have heard some horror stories. One person showed up to take their exam and the exam center was in an airplane hangar. And there were helicopters landing and taking off and, you know, small engine jets that were taking off and landing all day. And she said, I was so distracted. So if you have an opportunity, pick a testing center that is, first of all, close to you. If you can, if you have the option to do that, try to visit that test center a week or so before. Walk in, smell. I mean, because the last thing you want to be is distracted because there's an odor or it's not clean or, you know, those sorts of things. But that's a good thing. Go at the same time of day that you would be going to take your exam. Know what the traffic patterns are. Know if there's construction, if you're going to have to take a detour. Because again, the last thing you want is to be anxious when you get there because all of those things have happened.
Okay.
Don't cram the night before. As a matter of fact, take the day before your exam off.
Okay.
off. Go do something fun. Again, it's important that you are distracted, and it's going to help your brain really
Okay.
recall better information. Make sure that the day before that you've got all your documents that you need to take to the testing center with you. You have to have your authorization to test letter.
Okay.
You have to have 2 forms of identification. So
Okay.
pile all of that up so that you can just grab it or put it in the front seat of the car so you don't forget it. Make sure that the tires are checked, the gas tank is full, and then get a good night's sleep. I mean, I know that we have heard that all through school, but it is true that you are going to go into that exam with the freshest brain possible to be able to answer those questions.
I like that. And please try to eat that day.
Yes, a good
Eat
nutritious
something.
breakfast,
Yeah.
proteins,
Yeah,
anti-inflammatories.
that's right. Some complex carbs to fuel that brain. Yeah.
That's right. That's right. Your body has to have fuel.
Oh, I think these are all really good tips. Um, how do people find you, Kathy? And then tell us a little bit about what APEA has in resources and how to find those for the students looking.
So APEA, you can go to apea.com, and that's where you will find everything. We have the clinical practice guidelines book on there. We have Q banks, and that you can purchase those and you can do them computerized. We also have a book because there are some people, again, those people with all the highlighters, that would rather read a question in black and white and underline and highlight and pick out those key characteristics. So we have a question book, totally different questions than what's on the online question Q bank. So, you could do both if you wanted to. But those are on there. Review courses, the review course schedule is on there, and we have multiple different options. Again, we have the on-site, and that's 2 days. So you can see if we're going to be in a location near you, or maybe just a location you're like, you know what, I can write this off as a business expense, and I'm going to go there. That sounds like fun. Bring the family. But we also have online. We have 2-day offerings online for those of you that don't feel overwhelmed by that. But if 2 days seems like a crunch for you, we have a 3-day offering, so a 3-day online. And then new this year, we've introduced a 6-week course. So we meet 1 time a week for 4 hours. And so very slowly go through the information, plenty of time for questions. You have one consistent faculty that you gets to know you. And with that, you also get a predictor exam at the beginning and a predictor exam at the end of the course. So you're able to use those to focus on those areas that you really do need to remediate. We do have predictor exams for sale on the website too. I encourage you that if you purchase one, to treat it like a mock certification exam. So allow yourself 3 hours of time. Don't look up answers. Don't put your phone away. Tell the whole house, don't interrupt me unless the house is burning down around me, because that's where you're going to get the best knowledge about you and where your knowledge base is if you treat it like a mock certification exam. And again, if you're going to purchase one, 2 is sufficient. You can take up to 4 and not see the same questions, but 2 is really all you need.
Okay. 2, 1 at the beginning.
One at the beginning. Yes.
1 to plan that study.
That's right. And if you have any questions, you can email questions@apea.com.
Okay.
And if it's something that our support team can't answer for you, they'll forward that to myself or one of the other full-time NPs, and we'll answer it for you.
Nice. Beautiful. Thank you so much. I love this conversation because you've helped us kind of reframe this. A test is not a judgment of worth. You can prepare strategically. Everybody's got to do it. Yeah. Thank you, Dr. Baldridge.
You're welcome. That's what I always say. Any war was only won because they had a good strategic plan when they went into battle. So
I like that. Yeah, and to our listeners, whether you're a current NP student or you're returning for recertification, or maybe you're out there precepting students and you can
Yeah,
direct them back this way, we have a lot of practicing NPs. We hope this episode gives you some confidence and actionable steps for success. I always like to be able to do something.
that's right. That's right. And you will be successful. And, back to that anthem, tell yourself that I will be successful. You don't have to believe it to say it, but the more you say it, the more
Powerful.
you believe it.
Yeah, that's beautiful and powerful. I agree. We should be talking to ourselves nice more all the time.
Yes, toot your
Thank
horn.
That's right, because you're amazing. You're
You are.
here. Be sure to check out NPACE at all things NPACE at npace.org. We do in person too after you start practicing. We have on-demand learning if you need to practice suturing or you want to read an x-ray, or you can come to one of our great locations. Kathy joins us sometime. We were in Orlando
Yes,
this last year
we
together.
were. And they
Yep.
have great speakers at NPACE. You will learn a ton.
I love a good in-person, and we feed you breakfast and lunch, and we're back to that getting away and doing something fun while feeding your brain, connecting with people. Yep, we do that at NPACE, so you can find us at npace.org. We are an ANCC accredited provider, and for all of you new PA listeners out there, we also have CME through AAPA, and we're going to do a series too to talk about this exam prep for PA students. A lot of it is the same, but their blueprint's way more detailed. We could take a lesson.
I'm sure.
Yeah, yep, it's really good. All right,
Good.
so thank you everybody for being here. Join
Thank
us
you.
again. We're going to do more on this NP student series. So if you know someone interested in APP school or becoming an APP, join us for the rest of the series. Thank you, guys.
Thank you.